Welcome back, everyone. I'm Chris Groh.
And I'm Netta Rampur. Thanks for being with us on this Friday. So it's been a very long process, but now we're one step closer to getting the nation's youngest kids access to COVID-19 vaccinations.
In fact, today, the Food and Drug Administration officially approved emergency use authorization for Moderna and Pfizer-BioNTech vaccines for kids at least 6 months old. The move still needs approval from the Centers for Disease Control and Prevention. CBS 8's Dana Marie McNichol joins us to explain when that's expected to happen. Dana Marie?
Chris and Netta, I'm live here at Rady Children's Hospital, one of the places preparing to administer that vaccine for kids as young as 6 months old. Now, if everything does get approved, I was told the vaccination will start Tuesday bright and early at 7 a.m. I've also been told that vaccines have already been ordered for both Moderna and Pfizer. And so Dr. Bradley here explains the difference between both and how the symptoms might affect kids in different ways.
A few more side effects with the Moderna vaccine, a little bit more fever, not much, a little bit more irritability, not much. The Pfizer vaccine, the 3-dose, remarkably well tolerated, but you need all 3 doses in order to get the same immunity as you would get from the 2 doses of Moderna.
Now, Dr. Bradley says both are equally effective, safe, and been studied on thousands of kids. He said that the study looked for any safety signals that were seen in older kids and adults, like heart inflammation or reaction to MIS-C syndrome, but they found nothing of concern. The Moderna vaccine would be given in 2 doses, each a quarter the strength of what an adult receives, given about 4 weeks apart. So it makes sense that those side effects would be stronger. Then Pfizer, on the other hand, would be split over 3 doses, each a 1/10 of an adult dose. The first 2 doses would be given 3 weeks apart, and the final shot at least 3 months later. Now, another question parents have when it comes to the vaccination is when they can vaccinate their child if they recently had COVID. Dr. Bradley says at least 14 days from infection, as well as being symptom-free, is the earliest. Now, in terms of the timeline, when can we see this approved? Well, it could be as early as Monday. Right now, the CDC advisory panel is in a meeting for COVID vaccines for children under 5. The vote could come tomorrow, and if they get that approval again, by early as next week. We could see it. Rady Children's Hospital says that they're ready to go. 7 a.m. Tuesday morning. They're actually the first site in San Diego to administer the vaccine. They say that county sites will not have the pediatric vaccine doses, so make your appointment here if you'd like your child to get vaccinated. 5 years old all the way to 6 months old. We have the link for you, CBS8.com. Click the help button. It'll direct you to that website to make sure that you're all taken care of come beginning of next week. Again, this is all pending the CDC approval, but Dr. Bradley says he doesn't think there's any hesitation in it pushing forward.